My name's Andrew Messenger. I'm a consultant dermatologist at the Royal Hallamshire Hospital in Sheffield. Alopecia areata is a fairly common disease that affects hair growth, and occasionally it affects the nails as well. It usually presents with patches of hair loss, most often on the scalp, but they can occur in any part of the skin. In most people, the hair regrows on its own within a few months. But in a small proportion, maybe 1 or 2 out of 10, it can produce more persistent hair loss, and occasionally it can progress so that people lose all of their hair. We think it is what's called an autoimmune disease, which means the body's immune system is attacking its own tissues, in this case the hair roots. We know that there is a genetic predisposition to alopecia areata, and about 1 in 4 of people with the disease will have another family member who is affected by it. So the patients I tend to see generally have more severe hair loss than just a few small patches. They may have lost hair from other parts of the body, from eyebrows, eyelashes, beard area, body hair, for example. There are a number of treatments available for alopecia areata. None of them are curative, and none of them work in everybody. The simplest treatment, for which there is some evidence that it works, is to use a strong steroid lotion on the scalp, usually applied once or twice a day. Perhaps a more effective treatment for patches of hair loss is to inject a steroid into the affected skin. We use that quite frequently, and that will stimulate regrowth of hair in most people within a few weeks. Even in those people in whom the hair regrows spontaneously within a few months, almost all of them will get it again at some stage in their lives. Some patients will benefit from seeing a clinical psychologist, but many patients find, in my experience, find the most useful source of help is one of the patient support groups, of which there are a number throughout the UK. If you have limited hair loss and you're a female, there are a number of things that you can do to try and disguise the hair loss. With eyebrows, of course, cosmetics can be used. Many beauty therapists are able to do a semi-permanent tattooing procedure. For people with more extensive hair loss, hair pieces and wigs are often needed. For most people with a few patches of hair loss, the hair will regrow within 6 to 12 months. So probably 8 or 9 out of 10 will recover spontaneously within a year.